Hello friends. In today's class we will discuss about shock. So shock is one thing that you're going to encounter in your emergency settings, in your ICU settings, sometimes in your wards as well. So what is shock? Shock is a life-threatening manifestation of circulatory failure. So what is shock? Shock equals to circulatory failure. What happens after that? So this what is written in your on your screens is the definition of shock along with the consequence of what happens once a shock occurs, right? So like I told you, it is a life threatening condition. If not diagnosed at the right time, it may also be fatal, right? So what is the definition of shock? It is a state of circulatory failure. Now, once circulatory failure is there, what is it going to lead to? Cellular and tissue hypoxia. There will be a dearth of oxygen carrying capacity. The oxygen will not be able to be perfused to cells or the tissues, which will lead to cellular death and dysfunction of vital organs, right? So the next step would be cellular and tissue hypoxia, which will further lead to cellular death as well as dysfunction of vital organs at the level of tissue or organ level, right? So this is the definition of shock. So you have an idea what happens once a shock occurs. Now, next thing that you need to know is what are the types of shock. Okay, so coming on to types of shock. So usually whenever you see a table of types of shock or the classification a flow chart, if you see this, it starts from here. It starts from here, right? Just to ease down to remember the pathology of all the types of shock, I have added one extra line here, right? So I'll tell you what happens. See, there are different types of shock and they can occur due to different pathologies, right? So what happens is, let's divide them according to the source of pathology, according to the origin where the pathology is occurring. Okay, so it can either be in the blood itself, or it can be in the vessels, the ones which are carrying the blood, or it can be in the heart itself. Okay, so what happens when it is in the blood or when it is because of the blood? So first is blood. What happens is, the first we are reading is blood. So first is hypovolemic shock, next is dissociative shock. What happens in hypovolemic shock? See, as the name suggests, hypo means less, volume means volume. So when the volume is less, when will the volume be less? When the blood is being extracted out, right? So if the blood is flowing out, if there is bleeding, it will cause hypovolemic shock. If there is any loss of volume, loss of volume can be because of diarrhea, can be because of any fluid loss. Okay, so it causes hypovolemic shock. So first is your hypovolemic shock. What is dissociative? Dissociative is, again, the ability of blood to carry the oxygen is decreased. Okay, when does it decrease? It can be in a lot of poisoning such as nitrate poisoning, carbon monoxide poisoning, cyanide poisoning. So dissociative, you have to remember that the oxygen carrying capacity is decreased, and why it is decreased? Because of certain poisons. So, so we know what hypovolemic is. Now we know what dissociative is. Okay. Next comes is your distributive shock. Distributive shock is occurring because of any pathology in the vessel. Okay. So why are we calling it distributive? See, what are the vessels doing? Vessels is taking the blood from the heart and is distributing it all over the body. So if there is any error in the distribution, it is the distributive error. What are the kinds of distributive errors that can occur which can cause shock? So the first is neurogenic. What happens in neurogenic shock? As you can see, the word neuro is there. Okay. So how will you relate it? What does vessel do? They contract, they dilate, and accordingly the blood flows in the vessel. and they move from one place to another. Okay, so if this entire control of dilatation and contraction um, is removed, like if it is not if the vessels are not able to contract properly, if the vessels are not able to dilate properly, they will not be able to carry the blood properly. Their neurogenic shock will occur. So if we are saying that it is related to nerves, where will the injury be? Injury will be either in brain or in your spinal cord. So there is injury in brain or spinal cord which has caused loss of power of contraction or dilatation, which results in neurogenic shock, right? The next is your anaphylactic. Anaphylactic shock, is a kind of hypersensitivity reaction. What will happen? Excess of histamines. So what will these histamines do? What happens is, if there is excess release of histamines, this blood, in case of an anaphylactic shock, it is diverted from the core to the surface. From the core. What is the core? The core has all the vital organs, your liver, kidney, everything is there in your core. It goes to the surface, it goes to the skin. Okay, so in anaphylactic shock, what happens is the blood is not being able to be distributed to the vital organs, therefore their functioning decreases, right? So this is your anaphylactic cause shock, and as I told you, it will occur in allergic reaction, right? Next is your septic shock. Again, septic shock will again cause inability to carry oxygen to cells or tissues. And why will it happen? It will happen because of toxins or infectious agents. So whenever there is sepsis, it is going to cause septic shock, right? The last one is your psychogenic. So what happens in psychogenic? Psycho, as you know, it is occurring because of your psyche. So emotional stress, emotional trauma rather. So emotional trauma or fear, which is sudden and intense, or due to excessive anxiety. This psychogenic shock occurs. What does it causes? It causes temporary loss of circulation. It is temporary loss. Once the fear subsides, once the anxiety subsides, your circulation is regained. But at that temporary point of time, there will be a state of shock. So now you know the distributive shocks are of four types, and we have seen what are the causes. Now coming to the next part. What is left? Heart. When the problem is there in the heart itself. Now in heart there can be two issues. One is cardiogenic, the other is obstructive. So obviously your obstructive is also in your cardiac, is in your heart. But what happens is, in cardiogenic shock, there is some disease of the heart. Okay, there is some disease of the heart where the heart transiently stops functioning. Transiently stop functioning. When will that happen? It will happen in case of a cardiac arrest, or it might happen in case of electrocution, right? So these are the conditions where the heart will temporarily stop, and once it temporarily stop, it's not beating, it is not pushing the blood forward, so there will not be any distribution. Therefore this will be a cardiogenic shock. So what is obstructive? Obstructive, as the name suggests, it is causing obstruction. This is physical obstruction. There could be problem in some valves, or there can be cardiac tamponade, which is not allowing your heart to pump properly, cardiac tamponade. Then your pneumothorax, if there is any tension pneumothorax, again there will be no space for expansion, and there is pulmonary embolism. Okay, so in all these conditions, your obstructive shock occurs. So now we know what are the types of shock. We roughly know the pathology of all these shocks. So even if nobody is telling that the patient is there in neurogenic shock, if they are telling you in what condition the patient has been brought to you, you will be able to find out what kind of shock it is. See, why is this important? The kind of questions that you will be asked, the questions will not directly ask you कि the patient is having cardiogenic shock or the patient is having obstructive shock. The question that will be there will describe a condition. Suppose uh, let's say there is a kid and he was initially very threatened that he has to get good marks, but when the result was announced, the result was not very good, so he went into a state of shock, he fainted. So now you know that there was a temporary loss of circulation because of emotional trauma, because of fear, because of anxiety. So now you know that it is psychogenic type of shock, right? So similarly, if there is any hemorrhage, there is massive hemorrhage, you will know that it is hypovolemic shock. So there will be a scenario in the question, and according to that, you have to decipher what kind of shock it is, right? So once you know what are the type of shock, once you have deciphered which type of shock it is, the next thing that you have to assess is the grade of shock. Now, what is the grade of shock? Now, there is a table on your screen which you can see, and it is saying that there are four grades of shock. So, how will you find out what is the grade of shock? Will depend upon what is the amount of blood lost from the patient, what is the current vitals of the patient. All these things are going to determine your grade of shock. Why is grade of shock important? It is important, one, for your management, and two, to assess how critical the patient is. If he is in grade 1 shock, if not much of blood has been lost, if the patient's heartbeat is still fine, the pulse rate is okay, then the person can be like he can be treated with ease. But if it is class 4, it is grade 4 shock, then the patient is in a critical condition and you have to take utmost care of the patient and accordingly manage the patient with fluids, with blood, with whatever. Sometimes the patient may also be needing inotropes and all. So let's see how will we determine the grades of shock. So firstly, we'll see in class 1. So class 1 or grade 1 shock. So first thing that we need to see is blood loss. So we cannot know exactly the amount of blood loss. See, if the patient is brought to the emergency setting, we cannot know how much blood has been lost earlier. Okay, but if the patient is in ICU setting or is in the operation theater, we usually have the resources to find out how much blood loss has been there. Okay, so class 1, if it is there, up to 750 ml of blood is lost, it is just class 1 shock. 750 ml makes up how much? It should be less than 15% of your total blood volume. Okay, so as long as it is less than 15%, it is your grade 1 shock. The heart rate is within normal limits. You can see it is less than 100. There is no change in systolic or diastolic BP. There is no change in respiratory rate. Urine output is also well maintained. It is more than 30 ml per hour. Your extremities are normal and the patient is usually alert. He's responding, he's conscious. So whenever there is grade 1 shock, there will be complaint of a blood loss or there will be complaint of a certain situation. But the patient that you receive is usually in alert condition. The patient is conscious, his vitals are okay. Okay, so this is your first grade 1. What happens in grade 2? So grade 2, when the blood loss increases from 750, it is 750 to 1500 ml. The percentage it becomes is 15 to 30%. Heart rate is now changing to more than 100. It is usually 100 to 120 is what your class 2 shock sees. Okay. Systolic BP will not be changed in your grade 2 shock, but your diastolic BP will be raised. Respiratory rate also increases here, but your urine output is okay. Your urine output slightly decreases. Here it says it is 20 to 30, but it usually remains same. There is not much effect in the urine output. Extremities, now if you see the patient, the extremities will be pale, the palms will be pale, the conjunctiva will be pale. But and the patient will be restless. The patient will be anxious. He won't be as alert. He might be slightly disoriented, but uh, he will be anxious. There will be a loss of confidence in the patient. If you ask him anything, he might or might not answer properly. Okay, so these are the features of class 2. What is there in class 3? 1500 to 2000 ml, 1500 to 2 liters, 1.5 to 2 liters of blood loss has already occurred, which makes up to 30 to 40% of your total blood volume, right? Here the heart rate is going to increase more than 120. This is very important. Now class 3 demands your utmost attention. Okay, now here the systolic BP will be reduced, the diastolic BP will be reduced, your respiratory rate will increase more than 30, and your urine output will also significantly decrease. Okay, the extremities here will be pain. The mental status. Here the mental status of the patient, he will either be very aggressive or he will be very drowsy. Like he will not be responding very well. Okay. So this is how you will differentiate it into class 3. Now coming to class 4. Class 4 is when your blood loss is more than 2 liter. More than 2 liter, and it makes up for more than 40% of your total blood volume lost. Okay. Now here the heart rate will be more than 140. What happens to your SBP and your diastolic BP? The systolic and diastolic BP, if you feel the pulse become very feeble, thready pulse. When we have had massive blood loss, the pulse will either not be felt, or it will be very thready, very feeble pulse. Okay, and the same will happen on the BP screen also. The diastolic BP will most likely be not recordable, and the systolic BP will be very low. So this will clearly distinguish the patient into grade 4 shock. Okay, the respiratory rate will be more than 40, the urine output would be less than 10 ml per hour. This you have to remember. Now, extremities till now in the grade 1, they were okay. In grade 2 and grade 3, you can see that there is pallor developing. In grade 4, the extremities become cold. Why are they becoming cold? Now there is such immense shock that all the blood from the periphery is being transferred to the vital organs to save the vital organs. Right. So once the blood flow here in the extremities is decreased, your extremities become cold and clammy. This is one differentiating feature. And now what will be the mental status of the patient? The patient will be either completely unconscious, or if conscious, the patient will be very confused. He would not be knowing what is the time, place, person, orientation and all. This will be very difficult to find out in that patient. Okay. So these are the classes of grading of shock. I've told you why they are important and how can you distinguish them, right? So till now what we have read about the shock, the definition of shock, how shock occurs and what are the consequences of that shock, what are the various types of shock, and what is the grading of shock. So any question which involves finding out which kind of shock it is, or whether or not a patient is in shock, this class is going to cover all those kinds of questions. Still, if you have any doubts, you can write to us and we will answer your questions. For this class, this is what I had to tell you about the shock. Thank you.